Good morning. My name is Lisa Herpelsheimer, and I am the director and primary therapist here at Wise Mind Limited, a DBT practice. And today, this is just a very simply quick put together video to talk about the dialectical behavior therapy and, more importantly, the philosophy of DBT. We often talk about the skills-based parts of the practice, but today I wanted to talk a little bit about the philosophy and how the philosophy can be helpful in our relationships, not only in your relationship to yourself, which is a very important and critical part of change and acceptance that we work on in DBT, but also your relationships to other people. I would believe that many of the problems and distress that we face ultimately do relate back to some of our social problems. And those may be problems of getting along with others, problems with losing oneself in other people, and difficulty knowing where to set healthy limits and knowing what your values are even to begin with, so that you can set those limits for yourself. So this video is appropriate for both support persons, for someone who is supporting someone going through DBT, either here at Wise Mind or at a different practice. And it's also appropriate for participants who are enrolled in DBT services with me, or perhaps another DBT trained practitioner. A brief statement about DBT, dialectical behavior therapy, was indeed resolved and thought of basically by Marsha Linehan, PhD, a doctor out of Seattle, Washington. She is a psychologist, clinical psychologist, and what she did is she brought together a lot of aspects of classic psychotherapy that were important and were getting really lost in a lot of the change-oriented cognitive behavioral therapies. So DBT is a cognitive behavioral therapy. What that means is we do work on how we think and how we behave, and taking a look at what results we get as we kind of analyze our own lives, with the support of a therapist who can give feedback that is not only validating of the valid, but also holds you accountable to effective change in your life. So there's a lot of balance in DBT. Dialectics means that two seeming opposites can be true at the same time. I won't go too far into that right now, but dialectics basically means I can accept myself and I can change. I can accept another person and I can allow for them to grow. I don't have to have them to grow to accept them and know that they're actually doing the best that they can at any given point. This relates back to the assumptions of DBT. If you're with a practitioner who's doing genuine DBT to the model, to what we would call the Linehan model, the most studied over the last 20 plus years and endorsed by the National Institute of Mental Health, your DBT therapist ought to be using the DBT manual, Volume 2, from Dr. Linehan and her fellow researchers' work. And I'll show you a quick shot of that. This is available through Amazon, but also Guilford Press was the original publisher. So if you go through Guilford Press, that's certainly an option. You just have to search that. There's also an option if you buy this manual that you can get access to worksheets so that you can continue to use it on an ongoing basis. So any DBT practitioner should be using this type of work, and it really does need to be specific to this manual because this is a part of what's been studied and validated. So when we look at DBT, again, it's a cognitive behavioral therapy, but it's a bit more inclusive in the sense that we're bringing together some of the psychodynamic classic concepts of unconditional positive regard, a sense of supportive therapy, while balancing the change that cognitive behavioral therapies and very much behavioral therapies, if this, then that, and then here's a consequence of that consequence could be good or bad. We're very much behavioral in DBT, looking at things like what reinforces behavior, what makes behavior less likely to happen on the opposite side. So DBT is all about balance. Okay, it's all about finding the pieces or kernels of truth, as it's called, in one's philosophy as well as the philosophy of others. So when we think about the philosophy of DBT, you're not learning DBT just to meet your own needs. You certainly have to be respectful of what your own needs might be and come to DBT with a healthy level of humility. I don't want people to feel like they need to come to DBT in sort of a pool of shame and despair. Sometimes they do, and that's something that we just work with. We work with where the person's at. But more, I would like people to come to DBT with a growth perspective, that there's something that can be learned without them going to so much shame, thinking that they're doing everything wrong. It's not at all unusual to feel that way when your life has been in kind of a current crisis. DBT was developed, in fact, to help people that were in recurrent emotional crises that were ending up in hospitalizations over and over again in some cases. And part of the reason I work a lot with adolescents, particularly adolescent females, is because one of my missions, I believe, is to support using DBT early on in the lifespan so that we can interrupt some of the cycles of emotion dysregulation that were ill-managed because the person didn't have enough skills. It's a skills deficit model, it's something we can put in, okay? So these things were very intense, and a person doesn't know how to manage them yet. Well, DBT is offering you that. Okay, it's offering you that as a gift to really look at how can I manage what nature and nurture essentially has given me, a strong emotional, sensitive emotional system, and manage it in a way that's effective for myself as well as the people around me to help me get into the goals that I want. Okay, so what is effective versus what is right and wrong? Okay, effective versus ineffective, not right and wrong. Okay, growth model, not perfection or zero. Getting away from that part of the black and white thinking. Okay, certain parts of what we do are very effective in life. We're alive, we're adaptive, we do have relationships. Are those relationships where we want them to be? That's a great question. That might be part of the treatment plan. Oftentimes the treatment plan will start with higher up targets in the hierarchy of change, and that could be things like reducing suicidal risk, reducing the likelihood of returning to self-injurious behaviors to manage intense emotions. So when I think about the philosophy of DBT, it's a lot more of a mix of sort of a Zen idea that at any given moment, all I have is this present moment. That's mindfulness, right? That's really ultimately mindfulness. And that it's in this moment I can create effective change. I can't do it in the last moment, it's already passed. And I can't do it with an anxious process anticipating what's going to be next over and over and over again. Right? It's not about ruminating. It's not about pre-planning everything or perfecting our skills. It's about honing those skills, letting them come into you in a way that the skills become part of you, but they do not tell you exactly what to do. They give you steps, and then you kind of add your own jazz, if you will. You know how jazz is improvised, right? A lot of people come to therapy going, just tell me what to do, tell me what the plan is, especially if you're a parent and you've been dealing with perhaps some hospitalizations that were very scary or some behaviors that have really concerned you with your loved one. It's very natural to wonder, well, what do I do? Just give me the roadmap, right? Well, I will say that DBT is a roadmap for living, and it's definitely a roadmap for how to get through a number of very difficult situations. So it gives you these guideposts along the way, but ultimately you have to live the path in a genuine way. And this is where I'm getting back to the philosophy. So DBT is not about a list, of just coping skills that I'm going to just give you and say, oh, well, good luck. Most people have had that in therapy and it's been insufficient. So it's a mix of both processing and figuring out where those difficulty spots have been. We call it essentially chain analysis in DBT. Where have been the opportunities to use skills, and kind of what got in the way, and how can we maybe tweak that or look at that in a different way, a different perspective. So it's about continuing to work those skills into your natural responses in life. You're still you after DBT. Sometimes people are afraid they're going to become like some different person. No, it's very much of a self-discovery path too. What connects you to others is often a sense of feeling accepted and feeling a sense of maybe love, a feeling of warmth in your body, warmth in your chest when you feel a connection with someone. And that connection has to come from a genuine place of both vulnerability as well as a quiet confidence in who you are. So I blend both of those. I think that's important. I think we can look at vulnerability and accountability kind of on one side of our dialectic, but we can also look at, where are my values? Where will I make my stands that are really important to me so that I'm not in a position of going into shame if I violate my values or something like that, okay? So a lot of people don't know what their values are. Exploring your values and getting into your core self would make a lot of sense as part of you developing understanding DBT. So when we think about the philosophy of DBT, what I want you to think about is a path of self-compassion and it's effective compassion. That's something that Dr. Linehan talks about a lot in terms of what she was trying to do. She was trying to not only be compassionate towards persons requesting help, rather than judgmental, okay, or overly controlling, or just all compassion and no change. She was trying to find that middle ground. Okay, so again, thinking about balances, all right? How can I truly accept someone so they don't feel like they're in a situation where they're coming to us feeling absolutely terrible, that they have no resources? That's simply not true. People do have resources. It's how they've maybe used some different resources at different times, maybe been more effective or less effective. So effective compassion. So that starts first with effective self-compassion. How do we find effective self-compassion? Well, I'm going to take you back to a word that you hear a lot in our culture now, which is probably a positive thing, but could also lead to burnout, and that is mindfulness. Mindfulness is going into the self in a way that you can observe your own bodily reactions, observe your thoughts without attaching to them, and on purpose come into that different mindset of slowing down and becoming more aware of what an emotion may be. Like, for example, what does anxiety feel like in your body? What could that anxiety be telling you? Could it be an overreaction that's, firing off from a very anxious process that's been very reinforced? Maybe we need to look at something like that and start peeling away some of those layers. Perhaps it could be an overprotection of self, so much so that the feeling of being connected to other persons has been deadened or numbed, including the feeling of being connected to yourself. And this is where we get to the point of so much emotional suppression that the person feels numb. They truly feel numb. Empty is another thing that they'll often say. So we actually have to go inward before we can connect outward. And I think that makes a lot of sense to many people. A lot of the philosophy will make common sense. It's just a matter of on purpose using these different pieces so that you bring yourself into sort of a meta mindset. It's where you look almost above your own situation rather than just being in the situation. You become an observer, and when you observe, you do it in a non-judgmental way. Okay? To observe in a judgmental way your own process will probably bring about more negative self-talk. So negative self-talk would be things like, oh, I'm such an idiot, I can't believe I did that, why do I always do these things these ways, like I'm going to mess everything up. That's judgment, 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 judgment. We have another layer of this. To get you into a non-judgmental stance, we also challenge you to go one step further, not just to avoid the judging, if you will, or to try to inhibit some of our judging on purpose, because we all judge. It's part of what our brain does. But we're inhibiting it on purpose so that we can observe in a different way. It doesn't mean judging is bad, right? We need it in different ways. But right now, our challenge is how do we judge ourselves less? Because remember, we're trying to get to effective self-compassion as part of this philosophy. So how do we judge ourselves less? Well, one of the ways we do it is we try to put a stop skill there within our judging, in our own observing. So when we find that we're going into those old scripts of judging ourselves, judging others, making lots of assumptions, you have a very busy, loud brain at that time. That's what I want you to get away from when you're doing an on-purpose mindfulness exercise. I don't expect you to be mindful all of the time, constantly. That's completely impossible. Rather, I would want you to do this in spurts where you're doing this on purpose. Okay, so mindfully observing the self without judging the self, going, oh, a feeling of anxiety came over me. Maybe even looking for how those feelings make sense, learning how to self-validate. Gosh, that makes sense. I'm in a really new situation right now, and it's pretty overwhelming. And a lot of people would feel this way. Okay, so that's normalization. This is all mental process that you can have a choice to activate, rather than activating a mindful process of basically putting yourself down, okay, or predicting the worst. Okay, those behaviors are simply old behaviors, I believe, of essentially thoughts. Thoughts I almost look at as a lot like behavior, and essentially those thoughts have become almost so automatic that this is an on purpose turning that around. So what would it look like if you started to validate yourself rather than to judge yourself? Think about that for a moment. What would that look like? Where are the areas in your life that perhaps you've been over judging yourself? Maybe there are some areas in your life where you've been using a lot of judgment and old narratives to layer on top of things that are happening rather than actually observing what things are happening. Just objectively observing, like a fly on the wall, like in the court of law, what could I say actually happened in that particular interaction with someone, where perhaps you had a feeling of being rejected, right? And maybe that is part of an old script, right? And you don't have to condemn yourself for that. Rather, you can qualitatively start asking, where is that rejection coming from? What are some of those prompting events? People often use the words trigger. I don't like using the word trigger. You'll know that in working with me because I feel like that puts you in a one down stance. So-and-so triggered me is not something I think is helpful. I think it's more helpful to go, oh, I have a prompting event here. I really thought I was going to be connecting with my mom on this particular subject, and I was looking forward to talking to her, and I see that she's in a really different headspace. She's very busy with her smartphone. She's not able to connect with me. I'm feeling a sense of rejection because I was vulnerable in asking to process something with her, and I have a choice. I have a choice how much I'm going to amplify that, though, right? Am I going to go into the old script of she doesn't care about me, she doesn't love me, she doesn't want to connect with me? Those are all assumptions and judgments. So in order to actually get towards effective self-compassion, which is what this philosophy, I believe, is really all about, you're going to have to start learning to challenge that and go, you know what, actually she is just on her smartphone. That's what I'm seeing. I have a desire to connect. Maybe I can look at this in a different way. What's a way that I could assertively state my need while respecting the needs and limits, boundaries of the other person? So I want to talk to you just briefly about the give skill, because I think the give skill starts to illuminate some of the philosophy of DBT. So if you've got your manual, which I would hope that you might have or have handy, or perhaps next time you watch this video you might pull it out. Page 128 is our interpersonal effectiveness handout number 6, and it says guidelines for relationship effectiveness, the give skill. Now this is give is an acronym, okay, so that we can remember 4 points in how to interact more effectively with others. And I think it can also be turned inward as well. You know, if you're in being give, we will often say, are you being give? That means, are you using that skill? Are you actively doing that skill? Much like any verb, right? So give means to be gentle, to act interested, to validate, and that means to validate the valid, all right, and use an easy manner. So in interacting with people, we got to remember give. So we want to be nice and respectful. We do not want to attack people, either physically, obviously, or even making threats or judgments or assumptions, or using a lot of labels, things like manipulative, or if you don't do this, I'll do that. So that's under the threats, right? No sneering and judging. If you were a good person, you would do this more, you would do that more. Notice how angry a person may get on that thought process, and how frustrated they would get because their need to connect is not being met. So rather, we want you to be nice and respectful, you know, to have this easy manner that's talked about. So a lot of it is what not to do under the G. What to do is to be gentle. So to be gentle is to slow down, right? To be gentle is perhaps to observe. It's to observe in a non-judgmental way. So I'm kind of adding that a little bit more into that, what that word gentle might mean in a give skill. Our next one is to act interested. Now, if you're trying to connect with someone, and let's say they want to talk to you about an aspect of their day that frankly you just don't connect real well on, you know, and yet your ultimate long-term goal is that you do want to connect with this person better, then it's probably in your best interest to act interested. Okay, so acting interested is putting down your smartphone. It's making time to connect and talk to that person, and doing it on purpose. We live in a busy world, I get it, right? It really is a busy world, and yet it can be slowed down on purpose by a choice. So make that choice and say, let's do that 5-minute connection right after I'm done finishing dinner. We'll eat, and then we'll have 5 or 10 minutes where it's just you and I to connect. It'd be a wonderful skill to use with your daughter, for example, if you're a parent who's working on connection first. That's one of the first things we need to do in repairing a family system and really helping to shore it up, is to have a secure connection between parent and child, okay? And secure connection is a concept that relates to all of our relationships: a secure connection with your significant other, a secure connection with the idea of who you are even, okay? So we're going to act interested. We're going to listen to the other person's point of view. We're not going to interrupt them. We're going to face them. We're going to maintain eye contact. We're going to be genuine. We're going to be all in. So be give is also be genuine, be all in. That's another way to look at it. Okay, validate. We want to look for opportunities to validate something. It's one of the best things you can do. This is on our acceptance side of that dialectic I talked about earlier. So if we validate with our words and actions, we're looking for an emotion that makes sense, that would happen to probably anyone if they had that perspective of that person you're trying to connect with. So if they felt, if they expressed something like feeling rejected, feeling lonely, feeling ashamed, what we might want to do is look at, what are they telling me? Okay, there was a rejection frankly, just even behaviorally from a best friend, that didn't make a lot of sense. So perhaps your daughter comes home with more emotional dysregulation, meaning more emotional intensity, right? You can clearly tell she's upset, and she's upset about this cutoff, this lack of connection with this best friend. Okay, so you might be able to validate feeling lonely, feeling almost like a sense of surprise, shock. Wow, that would be really difficult. I think that would really increase my anxiety. That makes a lot of sense. I don't want you to become a miniature therapist. That's not genuine. So that would not be being give. Being give is being you in the relationship, okay? So I'm going to be gentle. I'm not going to rush to judgment, nor am I going to rush to problem solving with this person. I'm only looking to validate one thing, and that's the emotion. That's what I'm listening for, is the emotion that makes sense, that would make sense from anyone's perspective given those sets of prompting events, okay? So I realize this is hard for you. It makes sense that this, has caused feeling of really being sad. I can see that you're crying, and I'm glad that you're looking for a connection with me, because I really would like to hear more about what's going on for you. Okay, so kind of be casual, be you, right? Slow yourself down. Avoid the urge to problem solve for your child. Avoid the urge to share with them too many personal stories about, well, when I was young, this happened. That's actually not validating. You're trying to connect. I get it. You're definitely trying to connect. That's good. However, connecting just through your own experience may come across as a judgment to her that she's doing it wrong. Okay, so your well-meaning intention of support and trying to connect through a story from your childhood is actually not working. So what instead you do is you remember that time when you were rejected, perhaps on a school bus or something, and you have an urge to tell that story. What I want you to do is rather hold that urge and just feel the feeling in your body of that rejection, that that ooh, that just hit me like a rock, right? That's what I want you to have, so that when you're validating, you're all in. Again, you are all in the emotional experience. So you can use your old experience as an emotional map, similar to how anybody does, really, when you want to walk in someone else's shoes. You know that phrase, to walk in someone else's shoes. You're going to want to think about your own experience that helps you do that. So when you're working on validation, that's an area that you can pull to, is your own experience, and I will challenge you not to make it about you. Okay, don't turn tables. We want to stay on her. Okay, we also don't want to overdo. Too much talking can become very overwhelming for someone, especially when they're feeling a lot of emotional dysregulation. Your job, when you're trying to connect with someone and they're wanting to connect back, and there's behaviors that are okay. I mean, talking is what we want, right? We want to be able to connect over difficult things. It's better to talk those things out. So if that's all happening, you can definitely validate and get closer into the connection, and it's not going to take you a ton of time. It shouldn't. I would challenge you to make this kind of interaction about 5 minutes, maybe 10, 15 at the most. Think about how much your loved one can tolerate staying in that emotional intensity. Because really, a few well done validating statements, about, I can see that really looks like you're feeling very lonely. It makes sense, right? Is one of a good phrase to use. It makes sense you're feeling anxious. I can feel that anxiety in my own body when you're telling me that story. Ouch, that really hurts. Just hearing this for you. Okay, those are other ways to validate. It's really all you need to do, okay? And the last one is to use an easy manner. Now, sometimes it's appropriate to use a little bit of humor, right? Definitely it can be appropriate to lean in or to smile, right? But not be overdone, not be so stiff. Again, come back to gentle and genuine, acting interested and all in, right? Validating what you can that's valid. It doesn't mean you're going to validate the response that your loved one did. They may have done a rather ineffective response. That's not what we're talking about right now. We're not worried about that at this exact moment. When you're using a give skill, you're just trying to connect with this person to keep those doors open of connection. So you're going to leave a bit of your self-preaching attitude at the door, is one of the things that Linehan reminds us of in the skill. And I think that's valid. We're going to use a soft sell over a hard sell. That means we're going to invite that person to share more, or we're going to invite them to consider our perspective if we're trying to share something using a give skill. We're going to hope that, by using this easy manner, we're going to be able to be a little bit more open, more approachable, things like that. So it's quality counts over quantity when it comes to connecting with yourself as well as with your loved ones. So your first job, to come back full circle here and ending this video in just a few moments, is you've got to connect with yourself. You need to know what you're feeling in your body. You need to know what anxiety feels like, what loneliness feels like, what anger maybe feels like, when it's justified, when it's not justified. There's so much to learn, right? And as a model for your loved one, you need to be able to hold those emotions and not reject them in yourself, okay? So your loved one, meanwhile, is doing a parallel process of learning what she feels and what her values are, and the areas that kind of sent up warning flags, areas where she could use skills. So it's very much a parallel process in families, and the give skill is something that I would say needs to be used on both sides. Your daughter needs to use it, you need to use it, your partner needs to use it. I would really love it if siblings, could use it. Maybe they will, maybe they won't. It depends on your particular family. But really having parents and child be all in on how do we look for connection, how do we validate in a way that's genuine. It's not one-upping someone. It's not always going into teaching or preaching, right? It's about connecting, listening for the emotion that makes sense, being gentle. Now, when you do that, you're not only connected better with yourself because you're part of that interaction, so that has been compassion for yourself, but also compassion for the other. That type of soft compassion are kind of like soft places to land in DBT. Life can be very stressful. It can be very hard at times. We know that, especially if you have more emotional intensity, you might feel things a lot harder and a lot stronger than others. So you've got a lot of stress, if you will, that happens emotionally, but using something like a give skill and stopping down and it's slowing down, being mindful but not judgmental, these are some soft places to land in DBT. And I think that by landing on those places, the philosophy of what DBT really is about starts to knit together for you. You'll find that all of these skills are connected. It's shocking. Once you really understand DBT, and after about 6 months of probably practicing it and learning about it with me or another practitioner, it'll kind of like the light bulb goes on. You're like, oh my gosh, I can see how all this is related. That totally makes sense, right? And it just seems almost obvious when at first it might seem overwhelming. So that's kind of where we're headed. I'm hopeful that learning about the philosophy of DBT and the give skill today was helpful to you in your journey, and will continue to encourage you through learning more about DBT and practicing. Remember, the skills are not just there for you to intellectually learn, they're there for you to do. So I challenge you to use a give skill at your very next opportunity. I bet it's right around the corner. Thank you. I'm Lisa Herpelsheimer with Wise Mind Limited. We're located here in Delafield, Wisconsin. I provide DBT therapy for young adults as well as teenagers and their families. Thank you. Bye-bye.